Hello everyone. As you know that dentistry is moving from analog to digital and everybody wants to practice digital dentistry. Crown and bridge is not that difficult, but implant dentistry, if you totally want to shift to digital protocol, yes, there is a learning curve. And the most difficult aspect is after scanning is how you transfer your JR digitally. Especially when your lab is not in your town. Like for me, I give all my work to RR Dental Lab Hyderabad with their fire and forget concept. So I have to send my JR digitally if I have to complete my cases in 5 days. Because if I send it by courier, it will take 2 days and the wax will melt on the way. So we have developed few protocols how we send the scan, the JR digitally. So today in this video, we are going to discuss how to transfer your JR digitally to the lab. Okay. Hi, I am Dr. Sanjay Asnani. I am a practicing maxillofacial surgeon and implantologist in Ahmednagar. So today in this video we will discuss how to transfer JR digitally to the lab. So the prime requirement is, so once you have placed the implant, the protocol what we follow is, on day 1 we place the implants, okay? We put the scan bodies developed by Fire and Forget by RR Dental Lab Hyderabad. After sending that scan, we take an upper lower impression and we pour the cast. Okay, so once your cast models are ready, on the same day we take the JR. So this is all, we do it in-house only on the same day when the patient is in the clinic. So once the JR is recorded in the conventional way, now the biggest challenge is how to transfer this JR to the lab. Okay, so we'll see one by one the steps which we follow. So the first step is, when the models are ready, we attach these the markers. These are barium sulfate markers which we normally use for preparing a surgical stent on the denture. Okay, so we place these 3 markers in the upper cast and 3 in the lower cast. So what advantage is that this will help in merging of the upper and lower models. So first thing what we do is we scan these casts. Okay, so this is a Medit i500 basic scanner. So we just move the thing and you make sure that these markers are recorded very well in the scan. Okay. So once these models are scanned, the upper and lower models, same way we'll scan the lower model also. And then you can see here we have scanned the maxillary model and these are the barium sulfate markers. This is the mandible model with the markers. Now we will transfer the JR. Okay. So it hardly takes 2 minutes. So this is the JR which you have recorded in the patient's mouth. Okay. Place it on the model. Place the lower cast. Okay. So now, how to transfer this? Start the scanning. We need to capture this. See, now the JR is recorded. Hardly takes 30 seconds to transfer this. Okay. Once this is done, process it. You can see it in 30 seconds we have transferred this JR. And now this will be sent to the lab. Okay. So if you have a lab at outstation, it's very difficult to send everything over there and it takes a lot of time. So in this way you can transfer the JR. So once the lab receives this JR, this scan, they will send me the bar trial and the teeth trial second day. Okay. Or same day evening, I'll print it in the clinic. I'll take the trial next day. And 4th day, I receive the final prosthesis of this patient. I'll share the photos, post-op photos, how we completed this case digitally. Stay tuned. Thank you.